March recognizes Women's History Month. Many female professionals have overcome challenges and barriers on their paths to successful careers, paving the way for the next generation of leaders to follow in their footsteps. Today, we'll hear the story of one inspirational leader who has gained national attention. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Senior Writer with AHA. In this conversation, Darren Henson, AHA's Director at the Institute for Diversity and Health Equity, is speaking with Dr. Kimberlydawn Wisdom, Senior Vice President of Community Health and Equity and Chief Wellness and Diversity Officer with the Henry Ford Health System in Detroit. For the past 25 years, AHA's Diversity and Health Equity Institute has led the way in working to empower health organizations to provide equitable care for all people. More information can be found on the Institute's website. That's ifdhe.aha.org.
Thanks, Tom. Welcome to a conversation about health equity, diversity, and inclusion. Today, I'm delighted to be joined by Dr. Kimberlydawn Wisdom. Thanks for joining me to share your story and your insights.
Great, Darren. I'm delighted to be here.
These are dynamic times in healthcare. The data have shown that the voices of many people and diverse populations have drawn our society's attention to the structural systems of inequity in our healthcare delivery systems and delivery models. Dismantling the embedded injustices and creating new, inclusive, and more equitable structures calls for strong leadership, bold innovation, empathy, and a willingness to challenge assumptions and past practices. You, Kimberlydawn, have been a leader in this space. So I'd like to start with how you arrived at your current position and what it entails.
Great. Delighted to, Darren. My current position is at Henry Ford Health System, serving as Senior Vice President of Community Health and Equity, as well as the Chief Wellness and Diversity Officer. So my background and training is actually as an emergency medicine physician, which all pretty much occurred between University of Michigan and Henry Ford Health System in Detroit. But I had a great desire to realizing particularly the challenges that we saw in the communities and around chronic disease and violence, and that I wanted to move upstream and identify ways to prevent many of the conditions that presented in the emergency department, because I felt, and the literature supported, that many of these conditions were absolutely preventable. So decided to pursue a training in public health. So I attended University of Michigan and received a public health degree. And that was just very much aligned with my beliefs and values, because I really wanted to see medicine and public health come together, because the intersection of the two is where I felt that, change could occur, real transformative changes could happen. So armed with those two competencies, I started doing research and reaching out into the community to address many of the disparities that I saw. And lo and behold, Governor Granholm in 2002 approached me and asked me to serve as Surgeon General for the state. So gaining that experience in that space, state government, policy world, then allowed the opportunity to strive to make changes even in more robust ways, and then began doing even more and more research. Then after I served my 2 terms with Governor Granholm, I returned to Henry Ford Health System in my current role, which is addressing the needs of the community through sort of an anchor mission framework to do research, to close health and health disparities gaps, and address certainly achieving health and healthcare equity, and then addressing wellness and prevention. So that's my current role now, and just delighted to serve in that post.
You talk about working to close some of the gaps and disparities. As we come off of Black History Month, those of us working on health equity are mindful that our work arises from the history of systemic and sustained mistreatment of people or populations who were different, particularly Black women and men. How have you experienced the health system, and what motivated you to become a physician?
Well, I've experienced, these are both really great questions. I experienced the health system in many ways as a very young child, my first exposure when I had to have a tonsillectomy, which had a really profound impact on my life, because I think it was even then, by the time I was 7 years old, it was very clear that I wanted to pursue a medical career. I could see physicians. I could see that I wanted to be in that space to help in that restoration process for people that were going through a challenge or were vulnerable. But how I experienced even pursuing that career in terms of healthcare was very challenging, because despite grades that were good in middle and high school and honor society enrollment and that sort of thing, and this was in the late 60s and early 70s, I was discouraged about pursuing a medical career, largely because of my race and because I was a girl, a woman. They felt that there was no example of that existed. I was raised in a small town in Connecticut, Mystic, Connecticut. So my counselors guided me in a way to not pursue health care. So I sort of experienced doors closing and a lot of discouragement in that space. However, I had great mentors, great parents, people that were so supportive and encouraging me to still pursue a healthcare career. Ultimately, I was able to matriculate at University of Pennsylvania and then ultimately go to the University of Michigan for medical school. So I've experienced, in terms of my career trajectory, experience of healthcare in different ways, but much of it was because I had great supporters and was surrounded by people who understood my passion, understood my vision, even as a youngster, and could sort of fan the flames and allow me to not become discouraged, even though there were a lot of discouraging forces that I had to face during those times.
Wow, Kimberlydawn, you have tremendous tenacity, and you talked about being a pioneer even at a really young age. You were also the first state surgeon general in the country, and you were, as a woman, serving in that role for the people of Michigan. We're coming upon Women's History Month. I'm curious, who were some of the women who influenced you?
Again, very fortunate to have just wonderful women who were in leadership roles, whether they had a title or not, that mentored me, advised me, coached me, and at some levels even sponsored me. So I'd start off by saying my mother, who was a tremendous advocate. She was an adult in the thick of the civil rights movement. She had experienced sessions where she and other members of the church would meet with Martin Luther King, and so she was a tremendous advocate for the rights of vulnerable populations, the rights of the underserved. So between my mother and my father was very politically involved, and my grandfather, I was raised among people who were already pioneers. They were already leaders. They said, not necessarily with a title, but they were advocating for social justice. So seeing that on a regular basis, of course, influenced my life a lot. But then at the age of 14, I had a chance to be mentored by Dr. Dorothy Height. She's also a civil rights leader and led a major organization in the country. She was the chair of the board for the national YWCA. So I had a chance to meet and be mentored by her. I would say other people in my research world, Dr. Barbara Tilley, who's just a renowned health services researcher. I would say Governor Granholm, as I served as Surgeon General for the state. She was a tremendous mentor. I had clinical mentors like Dr. Kathleen Murphy. And then I had administrative mentors and CEOs like Nancy Schlipping, who was the CEO of Henry Ford Health System for 10 years. She played a major role in my journey in terms of mentoring. So I am a strong supporter of not just women, but especially women, but not only women, to have engaged with a mentor, because undoubtedly, if I didn't have the mentorship and the guidance from key people in my life, I would not have realized the milestones that I wanted to achieve. They were just absolutely essential.
Mentoring is really important for many of us, probably most of us. What would you say to a young Black woman or man starting out a career in healthcare or even as a physician?
I would say, and I say the same thing, independent of race, ethnicity. For one, I think it's very important to follow your heart, and in part follow what disturbs you. What are you troubled by? Because I think in many respects, what troubles you is where your passion could lie. And so rather than you see something that's very troubling to you, you can complain about it for a minute, but then if it's sort of a consistent area that troubles you, then pursue it. Pursue to make a difference in that area. So what disturbs you is what you should follow. And not to feel that you have to follow the beat of someone else's drum. You really have to listen to your own inner voice and see what stimulates you, what motivates you. Because in life, we only have, this isn't a dress rehearsal. And if you truly can find your passion, find pretty much what calling is, then what you do for your job or work is not a job. It is your calling. And with that, you find great fulfillment. It's a lot of work, not that there's no question there, but it's such fulfilling work that it motivates you to want to even do more or to engage more people. I would say you've got to follow your heart and find your passion.
Kimberlydawn, earlier in the conversation, you noted that there were some discouraging forces at times. You were just mentioning, though, following your heart. I wonder where you find your own inner strength, because this work of health equity takes a tremendous amount of inner strength at times. Can you say a little more about what motivates and sustains your own commitment to health equity?
Yes. My commitment to health equity largely stems from my feeling that it's a calling. This is something that actually, when I even referenced Dr. Dorothy Height when I was 14 years old, the reason why we developed a wonderful mentoring relationship was because I had been discriminated against, myself and many other students, at a YWCA camp. And our clothes were dumped out of our drawers onto the ground, and it was because one of the counselors checked the drawers or dumping the drawers of all the students who were of color. So that was tremendously disturbing to me. We were not children or young people that engage in any kind of substance abuse. And for that kind of behavior to occur simply because we were Black or African American was unconscionable to me. That drove me to then organize a group of teenagers, and we picketed the National YWCA on 600 Lexington Avenue at the time in New York City. And we picketed it during a time when the YWCA was having a board meeting, and Dr. Dorothy Height was chair of the board. So invited to present at that board meeting because they wanted, of course, the picketing to stop, and I shared, the concerns that I had, and ultimately was elected to a national position and was in a position to then affect change. So when you talk about inner strength, it's sort of core to who I am to address inequities and try to achieve equity, particularly in vulnerable populations. So I would say it's part of my DNA. And so the inner strength comes from the way I'm wired, the passion that I have. And it started very young. And many people said, will ask about even leadership. But when I was 14, I didn't think, picking the YWCA, this is an example of leadership. No, this is an example of being outraged about this treatment. And it looks like leadership, but it didn't feel like leadership. It felt like this is unconscionable and can't continue to occur. So I would say in part the inner strength comes from the conviction. I think also inner strength comes from, I'm a strong believer in God guiding my path. And I truly feel that the work that I am privileged to do every day is part of my calling that's beyond, that this is where I am on this earth to serve a purpose. And I feel when I'm aligned with the purpose that I think I'm here for, that gives an additional sense of strength, affirmation, motivation, enthusiasm. So it all kind of aligns, very well. So I don't have to try to conjure up getting motivated around this work. This is so core to who I am. I probably have to, and my family can attest to this, probably spend more time tempering my enthusiasm, because it truly is something that I believe I've been called to do.
Oh, that's great, Kimberlydawn. You also just mentioned affirmation of others. In our field, we pair diversity with inclusion.
Mm-hmm.
Let's talk just a moment about inclusion. How do you practice that?
Oh, inclusion is so key. If I can just give a little bit of an analogy in terms of a metaphor, how I think about diversity, equity, and inclusion, and where that inclusion piece fits. So when I think about diversity, I think about being in diversity of demographic, diversity of thought, so diverse people. When I think about diversity, I think about being invited to the dance, being invited to the table. When I think about inclusion, I think about, if we give that same metaphor regarding a dance, inclusion is that you're being asked to dance. So not only you're invited to the dance, but inclusion, you are actually asked to dance. And then when I think about equity, that you're given the greatest opportunity to dance well and, do your best and have the greatest opportunity to, do your best or close a gap, that sort of thing. So if you could just think of that metaphor. So in terms of inclusion, you can have a very diverse setting, but if you're not inclusive, you're truly missing the real value of diversity, because you're represented there, but your opinion isn't valued. You're not asked to contribute. So the inclusion is really being asked to dance. You can sit at the table, but your opinion needs to be heard and valued in a way where, when appropriate, those opinions are taken into account and followed through. So when I think about inclusion, a lot has to do with being able to listen and hear other perspectives and actually identify ways to incorporate those perspectives into the strategy or the path forward.
Yeah. Maybe one final question here, Kimberlydawn. With the good work that you're doing there with your communities, with the Henry Ford Health System, where do you hope this work in health equity will take us in the next 5 or more years?
So where I would hope the work of health equity would be in 5 to 10 years is that it becomes part of a strategic priority, that it's so core to what we do that it does not require extra committees or to actually identify ways to close health and healthcare gaps. So, for instance, data on clinical variables are stratified automatically. It becomes part of a systematic way that we look at data. And once that gaps are identified, then there is a systematic way to pull a team together to approach how we close the gap. Then an effort that is systematic, integrated, automatic, that looks at how we then monitor that those gaps that have been closed remain closed. And then it becomes sort of this loops around again. Gaps are constantly, there's sort of a surveillance mechanism in place to ensure that we identify gaps as early as possible, that there's a mechanism in place to systematically and thoughtfully and with best practice close those gaps, and then a way to monitor to ensure those gaps stay closed. So to the point where this is so ingrained in the processes and protocols of healthcare delivery that we don't have to single out what's happening in terms of equity. It becomes a standard protocol, and there won't be a need for committees to look at this specifically, because it happens in every clinic, in every setting, in a very deliberate and intentional way, but it's part of the way we conduct business every day.
Dr. Kimberlydawn, thank you so very much for all that you do in your role as chair of the board for IFDHE, and especially for the commitment that you have to advancing health equity in America. We so appreciate your insights and for contributing to the resources available through the AHA's Institute for Diversity and Health Equity. My great gratitude to you.
You are so welcome. It's been my pleasure.